Okay, it looks like the waiting is slowing down a little bit. Hello and welcome to our Missouri Open Door Benefits series for May. Today, we will be learning about Missouri's Crisis Response Continuum. My name is Cameron Rice, and I am a research assistant at the University of Missouri, Kansas City's Institute for Human Development. If you have any questions during the presentation, please put them in the chat and we will answer them at the end. This session will be recorded and uploaded to the Life Course Nexus YouTube channel. We will also send out the recording and the slides in a follow-up email. Next slide, please. Thank you. So our Missouri Open Door or MOD benefit series is sponsored by Medicare Improvements for Patients and Providers Act, also known as MIPA, Priorities 1, 2, and 3. The priorities are Missouri SHIP, the State Health Insurance Assistance Program, the Missouri Department of Health and Senior Services on behalf of the Area Agencies on Aging or AAAs, and UMKC IHD as the No Wrong Door designee for Missouri. The goal of Missouri's No Wrong Door is to transform the way people access services in the community and support individuals and caregivers to make decisions with complete and accurate information about their options for anyone seeking long-term services and supports, regardless of age, income, or disability. And the goal of this series is to open doors to integrated supports. So here you'll see the Charting the Life Course Integrated Support Star, which defines different types of supports and services. And the idea behind this is that when a person can rely on a mix of different kinds of supports, it helps them participate more fully in their chosen family, community, and the life that they want to live. Whereas if a person is only able to rely on one type of support, it can limit those opportunities. Within the integrated support star, there are 5 different types of supports, including personal strengths and assets, relationships, community-based supports, technology, which we talk about in the MOD technology series, and eligibility specific supports, which is what we focus on here at the benefit series. And this is our MOD schedule for the rest of the year. The benefit series, they are on the second Wednesday of the month from 12:30 to 1:30 p.m. And the next one will be on June 10th, and we'll be discussing centers for independent living. The technology series is on the 4th Wednesday of every month. Same time, our next one will be on May 27th, and we'll focus on tools, strategies, and and supports for parents. And I'm going to drop the links to the upcoming meetings in the chat, and then the rest of the links will be available in the follow-up email. And with that, I'm going to pass it over to Casey Rafferty to talk about our state's crisis response continuum.
Thank you, Cameron. I'll pull up my slides here. Let's see, can you see that okay, Cameron?
Yes.
Okay, great. Well, I appreciate the opportunity to share with each of you today. My name is Casey Rafferty. I'm with the Missouri Behavioral Health Council. We are basically the association for our substance use, mental health, and 988 call centers across the state in Missouri. And I work with all of our crisis response programs. So from what I'm going to talk about today, from 988 all the way through some other programs that we have. And I also work with our community behavioral health liaisons. I'll talk a little bit about them today. And I also work with our forensic population. So those individuals that are just as involved in, have behavioral health needs as well. And so May is Mental Health Awareness Month. And so again, I appreciate the opportunity to share during this time because we really want to normalize the conversation around mental health and substance use and make everyone aware of the resources that we have available and what we can do to help support all individuals within our communities. And so that's what I'm going to talk about today. The first slide I'm starting with, I know it seems like it's a little busy, but I like to show this because Missouri's crisis response continuum is very robust, but it's not perfect. Just like all systems, it's not perfect, but we are working to strengthen it. And the more we can do to keep individuals within their community or as close to their community as possible, the better off that they are. It's the least restrictive environment, it's the least costly to that individual and their family, and the least costly to our system. There's always going to be a need for that higher level. But if we can maybe divert out of that sooner and provide the necessary supports within the community, we feel like the more successful that individual can be. Missouri has actually been a leader in the country to enhance what we already had and build it to what we have now, and we continue to enhance it. But really, education and awareness is key to this success. So I just, ask each of you to help me spread the information and spread the awareness about these resources that we'll talk about today. So I really liked, Cameron, what you said earlier about no wrong door. And that's really true of all of our systems, right? No matter how someone presents to us, we want to make sure that they are brought in and taken care of and directed to where they need to be. And that's really our goal with our crisis care continuum in Missouri. We have three pillars, essentially the 988 suicide and crisis lifeline, our mobile crisis teams, and our behavioral health crisis centers. We consider those three pillars. That's someone to talk to, someone to respond, and somewhere to go. And we'll dig in a little bit more with each of these. So, Missouri has always had, I shouldn't say always, but for many years, well over 30 years, has had a crisis intervention. They called it Access Crisis Intervention. These were all regional or local crisis hotline numbers that many of our providers managed. And then there was also the National Suicide Prevention Hotline. And in 2022, there was legislation that passed and funding to help support changing that over to a much easier number to remember than the national hotline, which is 988. So much like what 911 has become for other emergencies, 988 is that number to call, text, or chat when someone is in a behavioral health crisis. And everyone's crisis can be different. It's not just those that are thinking of suicide, it's for any behavioral health crisis. It could be that you had a really bad day and you just need to talk with someone and you don't know who to reach out to. That's what 988 is there for. We're very fortunate in Missouri. We have 7 call centers, and that includes DeafLead, which manages our chat and text options for 988. And they also provide national chat and text support as well. This is 24/7. 988 is always on and always available. It's confidential if you choose. And like I said, it's not just for those that are experiencing suicidal thoughts, but certainly it is there for that. But it could be a substance use crisis. It could be any kind of mental health crisis. It can be any kind of emotional distress. And like I said, 988 is much easier to remember than that longer hotline number. And anyone can call or text. So if you have a friend or family member that you are concerned about, whether they're with you or not, you can contact 988 and they will talk with you and help you and provide you some resources and support so you can assist that person in your life that is maybe struggling. The call centers all triage, assess, they work to de-escalate and stabilize the situation, which most of the calls, well over 90% of the calls that come in to 988 are de-escalated by phone. But if not, then they can dispatch our mobile crisis teams as well. They can refer to resources, appropriate care. So wherever they're calling from, that call center will direct that person to the appropriate behavioral health organization to support them. Some of the questions that we get is like when to call 911, when to call 988, and a lot of people out there still rely on 911. We'd like to move that and shift that over to 988 for those folks that are just calling the 911 operators to talk to them. That's what 988 is for. But 911 is certainly there when every second counts, when it's an emergency, a medical emergency, and that person needs immediate attention, especially if there has been a self-injury or overdose. So making sure that the right people respond at the right time. But 988 is there to talk, to provide support. And if that individual does indicate that things have escalated, they can immediately respond or get emergency help to respond to that individual. So this is it's a website through DMH. It has a lot of great resources on there, and I've given these slides to Cameron so she can share those out with everyone. But there's a lot of great resources on the Missouri 988 website. And then that second link on the right-hand side, they do have some 988 items and merchandise that you can order free of charge. So especially if you would like to have some cards or posters to put up in your agencies or in your communities, I would encourage you to go to the storefront and order those. You do have to set up an account. And it looks like you're going to have to pay, but I can promise you, you don't pay. It's all free through DMH. They take care of that for us. And Cameron, you'll tell me if there's any questions in the chat I need to address, right? Okay, perfect. So moving on to that next pillar, that someone to respond, we have mobile crisis response. Like I said, almost all of the calls or text into 988 are resolved by phone. And that's a real testament to the specialists that work those call centers. And but if someone requests a mobile crisis response, they want to see someone in person, then they will dispatch that mobile crisis response. Or if things cannot be resolved by phone, then the call center will ask the individual, is it okay that I send someone to meet you wherever you're at? And this can be anywhere that individual is. It could be their home, it could be school, if it's a youth, it could be in a park, a parking lot, Walmart, it doesn't matter. Our mobile crisis response teams will go out to wherever that individual is and continue to work with them to resolve that crisis. And then the third pillar is somewhere to go, our behavioral health crisis centers. And this is what is relatively new to our crisis response continuum. And we have expanded in Missouri. We have expanded with our crisis centers over the past 6 years, from 5 initially that kind of built up on their own to securing some state funding through DMH and through our providers to be able to expand to now 25 operational behavioral health crisis centers across the state. And so this is a map. You can see where they're located. I'll have a link to our website later in a couple of slides so you can actually access and find out exactly those locations. But what this shows you is the red squares are those that are operational 24 hours a day. So they're open 24 hours a day, 7 days a week. The blue squares are those that we call an urgent care model. So much like urgent care that you go to for a sore throat, you can go to an urgent care model but it's a behavioral health crisis center. And those hours, they may not be open 24 hours a day, but they have tailored those hours for that community and what is best to meet the needs of that community. So in some places, that may be 7 a.m. to 7 p.m. In other places, that might be 10 a.m. to 9 p.m. It varies with each of those locations. And then you'll see also the circles indicate those locations that see youth. And those do accept different age levels. And so those numbers, I know it's kind of hard to see in there, but those numbers indicate the ages that they will serve and older. I will say any youth or child, anyone who presents at a BHCC should not be turned away. They will take them in, they'll kind of triage the situation, and then they'll get them connected to where they need to be. So for a youth, that may be, um, connecting with mobile crisis or connecting with a youth behavioral health liaison if that BHCC does not normally serve youth. And then we have one more planned BHCC that we know of at this time in Springfield, and that will be a youth serving BHCC. So we're excited about that. Centerstone is getting ready to open their what they call their youth resiliency campus, and that really is very unique. They'll have the BHCC on campus, but then they'll also have extended care for kiddos and even up to into residential that may need that level of care. So what does a BHCC do? Behavioral Health Crisis Center. It is ultimately an alternative to emergency rooms and jails for those with behavioral health symptoms. Prior to having our crisis centers open, especially if someone, called 911, this was before, 988 was around, called 911 or law enforcement or EMS responded, they had pretty much two options to take someone either to jail or to the emergency room. But that neither one is the best place for those individuals. And so we like to make sure that they are taken to the right place the first time. And that is what a crisis center can do. It provides a trauma-informed environment for those individuals to come in. You can see in this picture here, it's kind of like a living room. Yes, they have to have what I call medically stuff available in the BHCC, but they try to make it as comfortable and trauma informed as possible. So no matter what crisis that individual is experiencing, and again, it's not just for those that are thinking of suicide. It can be for any type of emotional distress. They can go into the BHCC and they will assist them in getting, excuse me, in getting connected, immediately to stabilize whatever their situation is, and then get connected to longer term care and other resources, because we know it's not just about their mental health or their substance use, it's their physical health, it's their dental, it's their housing and transportation and food, all of those basic needs that are probably not being met if someone is experiencing a behavioral health crisis. And again, we just reiterate it's a no wrong door approach, accessing that mental health and substance use treatment. So anyone can present at the crisis center. And like I said, they'll triage, they'll figure out like, can they treat them there? Can they get them taken care of, stabilize the immediate situation and get them connected long term? In a few situations, I will say they recognize that a higher level of care may be needed. And so the BHCC can work with that individual and with the family to get them to that next level of care that they may need. All of our BHCCs accept walk-ins and first responder drop-offs. I will say that with the first responder drop-offs, it's really cool because it is in and out. Anywhere from 6 to 10 minutes is usually the max that law enforcement has to stick around. And that's key because anyone who knows or has worked with law enforcement, if they take someone to the hospital, it's usually hours, sometimes days, depending on the location, that they have to sit there and wait with that individual. So this again provides that right treatment first time. They can also bridge medications and case management to that next appointment. This is really important because a lot of folks, they may start treatment, they may start going to their appointments, and then they drop off. They go off of their medications. And so the BHCC provides that opportunity for them to come back in and get started back on their medications, get some case management in place, and help get them to that next appointment. And like I said, most or some of our BHCCs are 24 hours a day, others are not. But no matter how long, how many hours they're open, no one stays more than 23 hours. That's part of that's a licensing issue. If they go to a different level once they start keeping people longer than that. And the goal is always to get someone stabilized and get them connected to that next step anyway. The average time that someone stays or is treated at a BHCC is usually about anywhere from 10 to 15 hours. But that always have that follow-up care and coordinate with that individual for that next step. All of the crisis services at a BHCC and for all of our crisis services in general are voluntary. So a BHCC will not accept someone who has been court ordered or has a civil involuntary detention. If that's already been put in place, then the BHCC cannot accept them. Now, there are times when someone presents to the BHCC, and a few times it may lead to a civil involuntary detention, but they do everything that they can to try to prevent that if at all possible. All services are provided at no charge. And that's really important because we never want there to be a barrier to someone getting that immediate service and immediate help that they need. And so please make sure if you're referring someone to a BHCC or talking to someone about a BHCC and really any of our crisis services, please know they're all at no charge. Now, once they get engaged in services, they may get that figured out whether they're on Medicaid or have other insurance, but just that immediate crisis service is not going to be billed to that individual. Again, no barriers. They provide warm handoffs, like I said, community linkages, helping with housing and transportation. I always like to point out they're not homeless shelters, but they will help all who present at the crisis center. And sometimes that means that that individual is homeless and they find that location to kind of get a sandwich, maybe get a shower and wash their clothes. And that's okay. The staff will take them in. That is, a crisis in and of itself when someone needs those things done. And anyone can call ahead and speak to the crisis center staff. So if you're unsure if you're working with someone that you may think needs a BHCC or a friend or family member, you can always call ahead and talk to them, and they can talk through the situation and help guide you, what is the best course of action. And this is our website, the QR code, the link, and like I said, Cameron will send this out to everyone. I'm going to pause. Any questions, Cameron? Keep going.
We have a couple if you'd like to
Yeah.
take them now instead of at the
Sure.
end. Okay. Someone asked if you spoke at a CTN summit.
The Children's Trauma Network,
Um,
maybe.
that's probably correct, yeah.
We just had the Children's Trauma Network Summit last month, I think. It's been a kind of a busy month. And I did not speak personally, but I know that we had several presenters on crisis services and especially those involving youth.
Okay. And then we have another question. Does anyone have providers who work with partial verbal autism youth who have aggressive behaviors?
Yeah, so like I said, anyone who presents at the BHCC should not be turned away. Um, it may depend on the level of staffing that they have at the time. This is a conversation that we have had ongoing with all of our crisis centers to ensure that if they don't have someone on site, they have resources maybe readily available to work with those individuals with special needs or varying abilities. And if they can't, then they will work with that individual and the family to get maybe to that next, like I said, no wrong door, get to the next step where they can get the care that they need.
Okay, thank you. And that's all the questions.
Okay.
Oh, just kidding. We just got one more. Is there a way to find similar resources in other states?
Ooh, that's a great question. I don't know specifically, like to say, yes, go here or go there. Um, uh, I know a lot, more and more states are developing like resource platforms where you can search for these resources. I'll show you ours later in the presentation. So other states may have something similar. I always go to the Google machine. And that, you could generally find resources that way too, or at least a first step to getting to that resource. We're always happy. I don't mind. I field questions pretty regularly to help connect people, that aren't sure like where to look or where to turn or what resource they're even looking for. And I try to track that down or at least get them connected to someone who could potentially help with that. That's a great question. 988, I will say, is available nationwide. So no matter where you are in the country, you can call, text, or chat 988, and that is available. And it's supposed to, depending on your carrier, your cell phone carrier should route you to the closest call center. So say I was out in New Mexico on vacation and I needed to call 988, then it wouldn't take me back here to Missouri. It would take me to the closest call center in New Mexico to connect with those resources. So 988 is available everywhere. And so that could always be, especially in a more emergent crisis, 988 would be that go-to to find in any other state.
Okay. And those are
Those
all
are
the
good
questions we have.
questions. I love those
Yeah.
questions, so keep them coming. I will move on and talk about a few more of our programs. It's part of the crisis response continuum, kind of outside of those three pillars. We have our community behavioral health liaisons. And these were established in 2013, so they've been around about 13 years now. And then Governor Jay Nixon had brought this initiative to Missouri that really helped start, I think, like the snowball effect of where we are today with our crisis response continuum, and that was called Strengthening Missouri's Mental Health System initiative, and the community behavioral health liaisons or CBHLs because we like our acronyms were born out of this initiative. And initially, there were only 31 CBHLs. We now have 116 thanks to expanded support and efforts and funding to be able to have 116 CBHLs. And we have a few teams that even have additional liaisons beyond the 116. So there's statewide coverage has always been statewide coverage, but now there's even more statewide coverage and really dedicated resources. These were initially brought into not just support the community, but support that and connect that crisis system to law enforcement and the justice system. So law enforcement, courts and jails, and really be that connective tissue is what I like to call them, and boundary spanners to really know, kind of be the expert in their community and be able to connect individuals and hopefully divert them out of the justice system and get them connected to the appropriate behavioral health and other social services that they may need, which, bottom line, we want to improve those outcomes for those individuals. We know that most of the individuals that come into our justice system have varying behavioral health disorders, substance use, mental health, and other issues, and that those are factors that fuel that criminal behavior. And if we can treat those underlying factors, help them meet their health related social needs, their basic needs, then by connecting them to those supports and treatment, they can at least get out of the justice system and not continue to recidivate. So the CBHLs are really there to answer general questions, both for stakeholders that they work alongside, but also the families and individuals that they serve. Our system, behavioral health system, and the legal system, two very confusing systems, right? Very overwhelming. And imagine going through both of those systems and having a behavioral health disorder. It can be very difficult to do. So having someone like a CBHL that can answer those questions and help guide them through and navigate through those systems can go a very long way. They can help and assist with involuntary commitments. We can't promise a bed, but we can do everything that we can to try to get that individual to that higher level of care if that is what is needed, and also work with them on that interim until they can get into that higher level of care, because sometimes there's a wait. And so it's supporting them through that as well. They can facilitate access to behavioral health services. So if they are engaging with someone, an individual that needs more immediate services from, especially outpatient, they can work with that agency to get them into outpatient services and psychiatric services maybe a little quicker than normal. And they also do a lot of training for our law enforcement officers, first responders, and all other stakeholders. And they participate with our crisis intervention teams, or CIT officers, across the state as well. And I will tell you, the CBHL goal is not to get that individual into their own agency. They are employed by each agency. So Compass has their CBHLs. Centerstone has their CBHLs. Clark Center down in Monette has their CBHLs. But their goal is always to get that individual connected to the appropriate services wherever they are also wanting those services too. So it's not to get them into their own agency. And you can use this link or QR code to find and contact your local CBHL. And much like the CBHLs, we have youth behavioral health liaisons. We started this program just a few years ago and modeled similar to our CBHLs, but serve specifically, obviously, youth, kiddos, adolescents, and their families as well. And we now have 42 positions that cover the entire state. So every county has a YBHL that they have access to, but they work really closely with our schools, our juvenile offices, our children's division, and law enforcement, because law enforcement still comes into contact with kiddos from time to time. So they can help direct those youth and those families into services, much like what I talked about with the CBHL. And again, it's not to get that individual, not to get that kiddo into a, their own agency, but they will work with them on wherever is most appropriate for that youth and for the family. We also have emergency room enhancement, or ERE. Again, we love our acronyms. ERE is a little different than our other crisis response programs, but it was also born out of that Strengthening Missouri's Mental Health Initiative. And initially, to look at those familiar faces that continue to come into the ER, continue to come into the hospital because they're seeking care, whether it's behavioral health, in addition to their primary care, whatever, they're overutilizing the hospital system. And so this helps direct those individuals to an ERE team, which we have access to in every county as well. And they work with that individual up to 6 months, and they can help with some of those things even that our other crisis services can't necessarily help with, but help get them with housing, those other supports, and hopefully reduce their use of an ER and hospital over reduce their use of law enforcement and other emergency services, and get them engaged in long-term behavioral health services to support them. And so I kind of bring it back around to show you we have from 988 to our mobile crisis teams to our behavioral health crisis centers. We have CBHLs, YBHLs. I didn't talk about it specifically, but our CIT teams, crisis intervention teams. So we have trained law enforcement and first responders across the state that have those de-escalation skills and can work with individuals. And this may be really important too when you're working with individuals of varying abilities. When you call, if you need an emergency service, request a CIT officer to respond because they have those skills to help de-escalate. And then emergency room enhancement. And again, no wrong door approach. All of our services are voluntary, and all of our crisis services are at no charge. So no barrier to receiving these services when someone needs them. And with that, you were asking about finding resources in another state. And this is a screenshot of our new Mo Navigator website. It is part of our Mo Connect system. Mo Connect is the dispatch system that we use for our mobile crisis response. So when a call comes into 988 and they are going to dispatch mobile crisis, they utilize Mo Connect. Mo Navigator is kind of part of that, kind of a sister to Mo Connect. And this is where you can search for resources, behavioral health resources. And I don't have the full screen, but you can search by zip code, you can search by city and state, you can search by need. We are integrated with Find Help. So anyone who's maybe heard of that, that's more of those social service, those health related social needs that can be searched for. And so this is just an all encompassing resource available, resource hub available to all of you. And if you click on Find Help Now, that actually goes to 988, to connect someone to 988 if it is more of an immediate need, or you can search for services within Mo Navigator. And that's my information. You are welcome to email me, call me, whatever you may need. I'm happy to, answer any other questions or share resources if you're looking for something in particular. That's what I'm here for. So Cameron, are there any other questions? I'll leave this up for a second before I stop sharing.
Okay. No other questions in the chat at the moment, but if you have any, please put them in there or come
Yeah,
off mute if you're able. You we did get some positive feedback. This was great, Casey. Thank you. I
ah,
learned a lot.
good.
Great information. I did have a question. You shared the community behavioral health liaisons provide training about behavioral health. Are those trainings, are they like for community organizations or are they
Mhm.
like specific as far as their attendees?
No, it can, yeah, they can present and train anyone. If it is a CI, they also work with their local CIT councils to provide CIT trainings. Those are usually prioritized for law enforcement and first responders. But our CBHLs, if you reach out to them, you can ask them to, they can do health fairs, have a booth, they can present to community groups or other organizations, anything to not only educate about the role that they have, but they can also educate about the crisis, what's available, those crisis services that are available for everyone.
Okay, that's great.
Mm-hmm.
It's a great resource. Still no other questions in the
Okay.
chat. There's lots of thank yous and compliments to you.
Oh,
Um,
that's very
yeah,
nice.
thank you so much. Oh, here we go. Um, I was wanting to confirm that Mo Navigator can help connect to behavioral health crisis centers anywhere in the country.
I not anywhere in the country. So Mo Navigator is specific to Missouri. I know Find Help as a separate search engine, you can search maybe a larger area, but for the Mo Navigator site, it's designed to bring up those Missouri specific resources, for, especially for our behavioral health, mental health, and substance use providers.
Well, if there are any more questions, please feel free to put them in the chat. But thank you so much, Casey. This was a great presentation. I learned a lot, and it sounds like everyone else did too.
Well, you're very
And
welcome.
yeah, and thank you to all of our attendees. It was really great having you all. We hope you learned something, and oh, and the QR codes will be sent out in the follow-up email
Yes.
For the
with
988
the
merch
slides.
as well.
The link to the 988 merch,
Yes.
it will be sent out with those
Thank
slides as
you.
well. Yeah, of course. Thank you. All right. Well, we hope to see you all next month. Thank you very much for
All right.
coming.
Thank you for having me. And please reach out with any questions or any resources that you may need. That's what I'm here for. Thank you. Bye-bye.
Thank you, Casey. Have a
You're
great one.
amazing, Casey.
Oh, it's good to see you, Patty.
Good to see you.
All right. Have a great day, everyone. Bye-bye.